Good morning, and thank you everyone for joining with us today, which will hopefully be a very exciting and informative session. As Rhonda did, I'd like to acknowledge the traditional owners of the land and acknowledge that I'm presenting today on Bidjigal land. So before we begin the webinar, I'd like to give a little bit of background about the Centre for Social Impact and my role within it. For those who don't know, CSI is a national research and education centre, and we operate out of 3 partner universities: the University of New South Wales, Swinburne University, and the University of Western Australia. Our mission statement is to produce research that catalyses social change, and we are a leading provider of undergraduate courses and postgraduate courses in social impact. And more than that, we aim to build the impact of the social purpose sector. Really, and that's a lot of the work that we're doing, great work that's happening as part of Impact 2020. For more information about CSI, you can visit our website, and the link is, I forgot that I'm on the PowerPoint as well, is on csi.edu.au. There we are, seamless. And my role at CSI, I'm a research fellow specialising in housing and homelessness. And really, my work and my cross-section with issues around temporary visa comes from a lot of work that I was very fortunate to be able to do with Monique, one of our presenters today, really looking at the issue of women on temporary visas experiencing violence and their children. And in 2018, which seems like such a long time ago, Monique, we worked together on a report, which was really a data snapshot looking at the issues faced by women on temporary visas and looking at their particular vulnerability in terms of having to stay with violent partners, but also within the social service system, and in particular, often experiencing long stays in the specialist homelessness service system. My role really today is quite brief, and just to introduce each of our presenters, who will all be focusing on a different aspect of temporary visas, and in particular, looking at the way that COVID-19 has really increased the vulnerability of this already incredibly vulnerable group. We're very fortunate to be joined by 3 fantastic speakers today. So Charmaine Crowe, who's the Senior Advisor specialising in social security at the Australian Council of Social Services. Monique Dam, who's the Advocacy and Prevention Manager at Domestic Violence, New South Wales, and Carolina Gotardo, who's the Director of the Jesuit Refugee Service. As Rhonda said, the way that we'll work, each of our presenters will have around approximately 10 minutes, followed by 20 minutes in Q&A. And I encourage you as you go, but also particularly as we get to the Q&A to really think of some challenging questions for each of our panellists. And without further ado, I might hand over now to Charmaine from ACOS, who will really be focusing on the issue of temporary visas and workers under COVID-19. Thanks, Charmaine.
Thanks so much, Chris. And I would also like to acknowledge the traditional owners of the land on which we are meeting in our respective places of work or homes or wherever you all may be. I'd also like to thank Chris and Rhonda for the opportunity to speak today with this Centre for Social Impact webinar. So thank you. Look, one of the key issues for us throughout this COVID crisis has been the fact that there are well over 1 million people currently excluded from the government's support packages in response to COVID. They are temporary migrants, asylum seekers, and international students who don't qualify for the JobKeeper wage subsidy. They also don't have, by and large, access to our income support system. So they can't get the double job seeker payment. They can't even get special benefit, which is the payment of last resort in our income support system. And in most cases, these groups are also excluded from accessing Medicare. So they really have been left high and dry. And of course, the vast majority of these people were not in a position and continue to not be in a position to make their way back to their country of origin, either because they can't get a flight home, right through to it being, unsafe to do so. That's why they're in Australia, they're seeking asylum. So it is a huge gap in the government's response, and we are deeply concerned that the majority of these people will end up destitute, because if they are not in paid employment, and we know that many have lost their jobs, what are they expected to do? The government's response thus far has been to increase funding for emergency relief services, with the expectation that there would be an increase in demand because there are large numbers of people that aren't protected by our safety net. And indeed, we have seen that. Many of you may have seen the reports from food banks saying that there has been a huge increase in demand from especially international students turning up at these centres not having eaten for a week. This is the kind of situation that people are finding themselves in. The government has also said that people will be able to access up to $20,000 in their superannuation in $10,000 increments. But we know that the average super balances for temporary migrants are actually quite low. And indeed, data released by the government through the COVID Senate inquiry showed that in 17-18, the median balance for a temporary migrant and people holding a permanent residence visa was just over $7,000. So you can see that if you have rent to pay, you may even have a mortgage, you may have kids to feed, etc., that is not going to go very far. And it's why we have been urging the government to extend our safety net to these groups during this pandemic. The other thing to note is that because temporary migrants are ineligible for JobKeeper, even if they satisfy all the other requirements, so, they're full-time or part-time workers or have been working casually for 12 months or more, their employer can't get that wage subsidy, obviously. And so they are probably first on the chopping block, to put it, crudely, for that employer, because they just can't afford to keep those people on. So they're most likely to be the first to be fired. And that obviously has huge implications for them, particularly if they had come to Australia and expected to be able to work, and support themselves. We reject the argument that the government has put forward that, stated that people had to show that they could support themselves, particularly for international students. They had to prove that they could support themselves for a particular period of time. I don't think anyone could have predicted that we would have a pandemic like we've had and that the economy would be essentially shut down. And so I think it's quite unfair to have expected these people to, had enough in savings or had enough support behind them to be able to sustain themselves for several months, and who knows how long people will need to sustain themselves until things are back to normal. The other issue we have is the expectation that people could have made their way home when the shutdown commenced, and that is just completely unrealistic. We know that the savings that people had were quite small, and so many people couldn't even afford a flight. But we also know there were many people who did book flights, got to the airport, and their flights were cancelled. So people really are stuck in Australia. We think there is no other option but to extend at least our income support system to these groups so that they can get by. And for us, this is really also a public health issue. I mean, if you can't pay your rent, you're likely to end up homeless. And that causes all other kinds of problems, for individuals and their families. It also obviously makes isolation much more difficult. And the other component is we fear that a lot of people will be reluctant to go and get healthcare because they may think that they're ineligible for it because they don't have access to Medicare, particularly if they need a COVID test or something like, even though people should be able to get COVID tests for free. That communication isn't very clear for people, and the concern is that people will assume that they're ineligible because they don't have access to our Medicare system. Lastly, I just want to touch on the issue of temporary migrants in particular, if they have managed to keep a job. We know that many migrants are in jobs that have poor conditions because they don't have access to our income support system. So they can't get things like sickness allowance, which you might recall the government put forward early on in the pandemic as an option for people who didn't have any sick leave. Because they don't have access to that payment, people may be reluctant to take time off if they're sick. And of course, that is the last thing we want. If people are ill, they need to be taking time off work to ensure that we don't spread COVID-19 any further. But you can see how lack of access to an income support system, lack of access to a safety net is a problem when you are trying to manage a pandemic, because people will make decisions on the basis of needing to eat. So, you know, this is another reason why it is crystal clear to us that these groups need to have some form of coverage throughout this time. I should note that we do very much welcome the government's moves at the start of this crisis to remove waiting periods for newly arrived migrants. And for those of you who are not familiar with the details of our income support system and access, if you're a temporary migrant, you don't have access to income support. If you have been here for a certain period of time, you gradually gain access to more forms of income support, but you have to meet other requirements to do so. We were pleased that the government removed those waiting periods for migrants who had been here for longer periods of time, because at least it meant that that group could get access to income support should, you know, if they needed it. We just want the government to go further, like they did with New Zealand citizens, which we very much welcomed. They got access to JobKeeper. We think that the same should apply to other migrants in Australia where they can't go home, or whether it's not an option for them to do so, and ensure that everyone has access to our basic level of income support so that people can, you know, put food on the table and keep a roof over their head. So thanks, Chris. I might leave it there.
Thanks, Charmaine. That's great. It was really helpful to get the policy overview of what's happening broadly in that space, and particularly acknowledging, I think, the difference between New Zealand citizens and what's happening for other migrants on temporary visas. So thank you, Charmaine. I'll now hand over to the wonderful Monique. So Monique Dam is the Policy and Advocacy Manager for Domestic Violence, New South Wales. And she will really be highlighting the focus of her presentation, will really be highlighting the situation, as I mentioned, for kind of women and children on temporary visas who are experiencing violence. So thank you so much, Monique.
Thank you so much, Chris. Well, first of all, I would also like to acknowledge that we're meeting on the lands of First Nations peoples across Australia and pay our respects to elders past, present and emerging, and extend that respect to any Aboriginal and Torres Strait Islander colleagues and friends we might have with us today. Thank you so much, CSI, Chris and Rhonda, and to all of you for joining us today. It's really great that you've created this space for us to have this conversation. So just as we all know, today I'll be talking about people on temporary visas who are experiencing sexual, domestic and family violence. We do know that sexual, domestic and family violence is gendered and disproportionately impacts on women and children. But we also know that LGBTIQ people experience these forms of violence as well. So as Charmaine already highlighted, today when we're talking about people on temporary visas, we mean people on a whole range of different visas, including partner visas, working visas, student visas, tourist visas, and carer visas, among the many more that exist. And I just wanted to highlight that the woman who was recently killed by her husband in her home in Quakers Hill, Kamaljit Sidhu, was on a student visa at the time of her murder. In terms of what we're seeing to be the impacts of COVID-19 on people who are experiencing violence generally, what we're hearing from our members at Domestic Violence New South Wales, who are specialist services working with people experiencing violence, are that there is an increased risk of sexual, domestic and family violence because people are more isolated from work, from school, from friends and family and other support networks. And that's compounding the kind of social isolation and abuse that a perpetrator uses to control a person. We're also hearing that there are greater barriers to leaving a violent partner or a family member, and that's because of loss of income or fears about contracting the virus or spreading the virus if a person accesses services such as shared accommodation. And that's despite services really taking measures to make sure that the risk of infection is reduced. There are also increased difficulties for people in making an exit plan, and that's because an exit plan for leaving a violent perpetrator would usually include, staying with friends and family or staying with parents. But for many people, they're concerned that if they're going to stay with older parents, that they might put them at risk of the virus. There are also fewer opportunities to safely access support. And by that, I mean people are being isolated or they are spending a lot more time than usual with the perpetrator and also with children. And that can mean people only might have a few minutes where they have some time to themselves to make a call. That's what we're hearing from services. There are also reduced face-to-face community outreach activities. So for example, community yoga groups or gardening groups that are run by community services as a soft entry point for people who might be experiencing violence. So we're concerned that people who might attend those and who don't know where to go for support may be even less likely to disclose at this time. There are also additional communication barriers for people who need to use an interpreter, for instance. So we've heard that it can be really overwhelming for a person who's using an interpreter, trying to access a service with their support worker also on the line. So that's 4 different people trying to communicate over the phone with an interpreter. That can be really overwhelming for people. What we're also hearing is that perpetrators are using the crisis as another tool of power and control. And so, for instance, there are people who have said perpetrators are actually saying, if you leave, you're putting yourself and our children at risk of the virus. In terms of the specific barriers to safety for people on temporary visas, so Charmaine has already really highlighted that lack of access to income is putting people at risk, to their health, to their well-being in general. And for people who are experiencing violence, it really can mean that people don't feel they have the option to leave, because leaving would mean risking being in poverty. Many people on temporary visas, as Charmaine said, can't access Centrelink. Many of the people on temporary visas, including women on temporary visas who are experiencing violence, have children, and they're often not eligible for any childcare support. So they have childcare responsibilities, can't access Centrelink. Many of them don't have the right to work or have limited rights to work. So all of those really make it, in practice, really difficult to access any income. Access to housing is a really big issue. So in New South Wales, people on temporary visas under New South Wales housing policy can't access any crisis, social and community housing. And temporary housing is really kind of actually outside of policy guidelines that sometimes people can access 2 to 5 days, or with the support of an advocate can access some more days, but really that's such a short amount of time for someone who's experiencing violence and needs a safe home. We know that many of them are unable to access healthcare because of barriers to accessing Medicare. They're ineligible for Medicare, many of them. And in New South Wales, if you're not eligible for Medicare, there are very, very limited circumstances in which people can still access public hospitals. So including if someone's in a high risk pregnancy, but if you're not in a high risk pregnancy, and you're experiencing domestic and family violence, a person will still be charged as an overseas visitor. And for someone who has no access to income, you can imagine the kind of stress and anxiety that creates. There are also barriers to accessing legal support. So people can access, there are some free legal services such as Refugee Advice and Casework Service, the Immigrant Advice and Rights Centre that provides support to people on temporary visas. But a lot of them have, particularly if they're experiencing violence, have very complex legal issues that are at the intersection of domestic violence, migration and family law, and sometimes child protection can become involved as well. I just wanted to quickly share a story of Mariam and Tamba. So these are not their real names, but this is a real story of a woman and a child who have been living in a refuge for 3 years in New South Wales. And this is because Mariam moved to Australia on a partner visa and was experiencing violence, or her partner was using violence against her, and this escalated during her pregnancy. So at that time, she fled and moved to a crisis refuge. But because she doesn't have access to income, she doesn't have access to housing, she's been living on food vouchers on a week-to-week basis with her child for 3 years. And she also has a health condition, and she's been told by the public hospital, the local public hospital, that she will be charged for any treatment or any stays at the cost of an overseas visitor, which is thousands of dollars. And as I said, she has no access to income. She's also ineligible for the government childcare subsidy. And how the crisis has impacted on Mariam and Tamba is that a lot of services are being run online or over the phone, and they have no access to income, and so they have very little phone credit and internet credit to use each month. So that's a story of a family living in New South Wales today who's experienced violence. So what can we do to ensure that people who are experiencing sexual, domestic and family violence can be safe and well? Well, in April this year, DV New South Wales is part, and so is Jesuit Refugee Service, we're part of a national advocacy group on women on temporary visas experiencing violence. And we put together an open letter to the Commonwealth, state and territory governments with some key demands. This letter was signed by 60 organisations across Australia and called for access to social security and Medicare so that people can access food, essentials and the healthcare they need to stay safe, healthy and well. We are calling for access to temporary crisis, social and public housing, as well as rental assistance and safe at home programs so that people can isolate safely. We also called for free legal advice and representation so that people can understand how the law can help them and their children to stay safe under migration law, family law, and domestic and family violence law. We're also calling for free interpreting services so people can understand how to stay safe and well during the COVID-19 crisis and how they can access essential services. We've also asked the governments to roll out flexible support packages. So these exist in Victoria currently, and they mean that people can attend to their immediate needs. And in Victoria, that's up to $10,000, and you're not excluded from accessing them if you're on a temporary visa. If you are an organisation that works with people on temporary visas who are experiencing violence, I would really encourage you to complete a survey that DV New South Wales is currently running. So this survey is really intended to capture some of the issues and barriers that people on temporary visas experiencing violence are facing. And this survey is targeted at providing data that was collected in May. So if your organisation is interested in that survey, I'd really encourage you to complete it. That would be so helpful. The Minister for the Prevention of Domestic Violence has already indicated he's interested in the findings. So as much data as we can get will really help to highlight that this is an issue and that action needs to be taken. You can also join the National Advocacy group that I mentioned, or in New South Wales, we have a community of practice on women on temporary visas experiencing violence. And if you're interested in either of those, please feel free to send me an email at advocacy@dvnsw.org.au. Thank you so much.
Thank you, Monique. Thanks, Monique. It's great to actually see the practical advocacy strategies that DV New South Wales and the National Coalition, including the Jesuit Refugee Service, are working on as well. And on that note, I'd like to introduce Carolina Gattano, who's the Director of the Jesuit Refugee Service. And we're very fortunate that she will be presenting to us on the lack of protection for migrants and people seeking asylum due to COVID-19. Thanks, Carolina.
Thanks, Chris, and good morning to everyone. Thank you so much for the invitation from CSI to participate in this webinar. I think it's very timely and very important because this has been a crisis for all of us, but I think the forgotten people have been migrants and people seeking asylum. And if we see the response of the Australian government, we could say that in terms of public health compared with other countries, and in terms also of support packages for citizens and residents, it has been a good response. But the failure of the response has been to leave a segment of the population completely excluded from this response. And this has implications in terms of public health and in terms of a potential second wave that has happened in other countries, like Singapore, for instance. But it also has implications in terms of human rights and the situation where we're putting members of our community. So we are providing services frontline, and we are an essential service. And what I'm going to do is to share some of what we're seeing at Jesuit Refugee Service, because really the situation has been devastating. So let me, and it has affected the people and the organizations working directly, the community services working directly with the people, and I think every Australian, because of the public health component that I mentioned. So let's start with the stories, because I think that stories are always powerful. So let's talk about Niraj. And Niraj came to Australia seeking protection in 2019. During the summer, he was volunteering in terms of the bushfire response in the south coast of New South Wales. And he was actually serving meals and cooking to people displaced by the fires. In January, Niraj found a job at a restaurant in Wollongong, and he relocated there. But on the 25th of March, he was told that the restaurant needed to close and indefinitely, and he kind of ran out of work. He had $40 savings, and his rent was $350 and was due. Negotiations with the landlord actually were extremely difficult, and we were supporting him. And what has been happening since then is that we have been supporting him with weekly deliveries and with some of the rent. He's now also experiencing mental health issues, and these have been growing. Also, another, Leila was working at Nando's. Our employment coordinator had been working with her in 2017. It was hard to secure a job. She was doing very well. She has 2 children. She lost her job. And again, she's completely relying on charity. And these are only 2 cases, but we have hundreds of cases like this. and also cases that have to do with domestic violence, like Monique was talking before. So basically, what we're seeing as a trend is that most of the people were in the temporary like in the casual sector of the economy, and they have lost their jobs or the shifts have been reduced. And this has a massive impact, because what it means is that they don't have enough money for basic food, for medicines, or for paying a small amount of rent to even keep negotiating with the landlord. So the situation is very, very difficult, and they do not have this access to Centrelink. There is also a component of anxiety, because we have so many of them reading in the news about the JobKeeper, the job seeker, and not understanding why they are not covered by these payments when the workers at the same level are covered by these payments. So basically, the numbers of people contacting us in crisis has risen significantly. We have so many being threatened with eviction despite the moratoriums on eviction. We have so many that cannot buy basic medicine, and our demand as a service has increased by 224%, which is a quite incredible number when you think about it. For instance, right now we have 170 referrals that we have not been able to deal with just yet, because our capacity is limited, and we're doing the best we can. This is despite the fact that we have tripled our emergency relief budget. So we actually have increased our services quite a lot, but the scale of the crisis is enormous. So food security is a major issue. We're currently delivering food on a weekly basis to 680 people every single week. And this was a massive logistic change for us, logistic operation. We had to, we are pre-packing the bags, and we are operating a system of mobile distribution with the help of volunteers and dispatchers and packers 3 days per week. And we have collection points across Sydney where people can drop locally to source some of this food, and we have to buy a lot of the food because it's not enough. Another very worrying aspect is mental health. So our case workers are reporting depression, anxiety in terms of the people they are seeing, and also a spike in suicide ideation. So what they are saying is that 90% of the conversations that they are having have some components of suicide ideation, and this is very, very alarming. With relationship to health, many of the people that we support do not have access to Medicare, like it was said before by Charmaine and Monique. There is an overall lack of access to healthcare and concerns about presenting to hospitals due to fees. We also have seen, and this has to do with what Monique said, a number of women in terms of the issue of being trapped at home 24/7 with the perpetrator, really unable to access any help, and in a very, very dangerous situation when they are at risk or survivors of sexual and gender-based violence. And this is basically, if it was hard to access refuges and services before, now it's much, much harder, and Monique already explained that. And also many, many women are in need of basic survival, like food, and we are for instance, distributing dignity packs through our center in Parramatta, which is very essential for women now, and doing emergency one-to-one appointments. I also have to talk about the impact on case workers and volunteers, because that's also concerning. Basically, we're facing this increased demand, and some staff report feeling particularly overwhelmed by the sense of having helped some people to reach a point of independence, and seeing the same people back again and relying 100% on charity because of the situation. We had around 90 volunteers before. A lot of them couldn't continue with us because they were either older or they had existing health conditions. So that was also a massive issue for many NGOs. And we have attempted to be resilient as an organization, and I think we have delivered a quite good emergency response, but the scale is just not comparable with what we can do as a charity. Basically, we need systemic change, And it's not fair that the whole crisis is now dependent on what charities can do for people. This is a responsibility of the government. This is not a responsibility of NGOs that are really trying to do their best in very challenging circumstances. So basically, we have put a lot of efforts on advocacy and to push for a systemic change, trying to influence federal and state level, asking for a safety net regardless of status. I mean, most of our clients are people seeking asylum, and they face very specific situations. I mean, for many others and for migrants, going home is not an option. In their case, they are still having their claims being considered. So it's absolutely impossible for people seeking asylum. We're talking about around a little bit less than 100,000 people across in the community in Australia, which is not a small number. Excluded from JobSeeker, JobKeeper, special benefits. And this sits on the top of a history of exclusion, really, and a policy of forced destitution by cuts in status resolution support service, patchy renewals of bridging visas that actually make them unlawful in many times, and lack of access to Medicare. Really, we were thinking logically, the 60 billion overestimation of the JobKeeper that the federal government has now gives them a lot of room to provide a safety access for migrants and people seeking asylum. For instance, if we talk about costs, the status resolution support service only costs 129 million before the cuts. So if you compare that with the 60 billion that they overestimated for the JobKeeper, this is not a monetary issue, and that's the point I'm trying to make. Also, keeping some people excluded raises significant public health concerns. We have seen it in Singapore with the migrant, where the second outbreak was specifically on the migrant workers. We have seen second waves in different countries, and it's in the best interest of all Australians to include everyone, absolutely everyone, in coronavirus response. We are working with many networks in terms of campaigning. So for instance, we're working with DV New South Wales and the National Advocacy Group with the issue of women at risk or survivors of domestic and family violence. And we are also working with the Refugee Council and Nobody Left Behind campaign with the Sydney Alliance and many other groups. We have produced our own discussion paper on the impacts of COVID on asylum seekers, which we will share, and an online petition. And our ask, just to finish, is very concrete, and is that we call on the federal and state governments to extend the vital safety net, which includes financial support, Medicare, and adequate shelter to absolutely everyone in need in the Australian community. And it needs to be done regardless of status during the COVID-19 pandemic if we want to see a serious public health response for all Australians. Thank you very much.
Thank you, Carolina. That was fantastic. And it's really helpful, I think, your presentation to give that mix of what's happening from a service level, but also looking at the advocacy work that Jesuit Refugee Service is doing. So thank you. I'll now hand over to Rhonda, who's going to facilitate our brief Q&A that we have with all our panelists. I can see there's a lot of questions coming up, which is fantastic. So please continue to ask your questions. And I'll now hand over to you, Rhonda, to facilitate this part.
Thank you so much, Chris, and thanks so much to all of our panelists. That was really interesting and insightful. And to be honest, really shocking in some parts. I found some of it really hard to hear, but it's important to talk about it, obviously. So we have a number of questions, and I encourage others to submit them in the chat feed. But for now, I'll head straight to the ones that we have. Charmaine, the first few are for you, which makes sense because we're in logical order. Are there examples of other countries financially supporting temporary migrants that Australia could emulate?
Yeah, thanks, Rhonda. Look, there are. Recently, the New Zealand government announced that it would extend income support to international students, which was obviously very welcome. And we'd love to see Australia follow suit In the UK, temporary migrants under some conditions can get access to the wage subsidy. They have also extended some income supports to certain cohorts as well, recognising, you know, that people, you know, need a level of income. So there are examples of countries stepping in and providing assistance. And it is certainly not beyond the Australian government to follow suit. As Carolina very well put, this is an affordable measure, but more than that, it's something that must happen for people's health and security.
Did you want to just unmute yourself?
Yeah, I wanted to elaborate on that because probably some of the best response globally has come from Portugal and Italy, where actually it has gone even further into regularization packages for basically visas, and support has been extended to migrants, including undocumented migrants during the COVID crisis. And this has been, like, Portugal has been used as a kind of beacon around the world. And in Italy, a whole regularization scheme is being studied and almost approved for a number of migrants. So those cases in Europe are being used as a global kind of pressure in terms of what can be done, and that extends to support. It goes actually much further than support because it goes into the legal status.
We've just had a question which ACOS and JRS from Asha. Have you had any traction in your discussions with the federal government regarding extending JobKeeper to temporary visa holders?
We are still trying. This is something that we have been raising, you know, every other day with the federal government. We recently wrote jointly and released a public statement with FECA, the Federation of Ethnic Community Councils in Australia, and also COSBOA, the Council of Small Business Organisations of Australia, because small business is really affected by this. Calling for temporary migrants and other groups to have access to income support, JobKeeper and Medicare. The government has just, it's stuck its, you know, it's digging its heels in on this, and it is convinced, I think, that the people will be able to access their superannuation and they'll be able to access emergency relief and get through this. But that is obviously not the case. I encourage anyone on today's webinar who may be working for a service that is helping the people we're talking about today to send both the Minister for Families and Social Service, Anne Ruston, and also the Treasurer, Josh Frydenberg, evidence you have of increases in demand for emergency relief, evidence you have of people losing their homes, evidence anything you have that shows that the current response by the federal government is completely inadequate, because I think they really need to see that their lack of action in this space is having disastrous consequences for people in our community who we rely on, and it's just not good enough. But Caroline, you might want to add to that.
Thanks, Charmaine. I think Charmaine has touched on the key points that is essential to continue putting pressure. The response of the government, and Charmaine stated before, has been in terms of a little bit of money for emergency relief. So basically, if you think about 7 million to the Red Cross, what is that really going to do in the grand scheme of things when we're thinking about the numbers that are affected by this? And actually what people think that because the government announces that all of us, like small NGOs, have funding, that is far from true. Like, the people that are providing the response are getting no funding from the government for emergency relief, and the money that has got to the Red Cross is very little. I mean, the Red Cross has been absolutely overwhelmed in terms of demand and being able to provide response. So that's, again, another band-aid that is not going to sort out the problem, and the solution is to continue putting pressure so that the safety net gets extended.
Nina just made the suggestion, Nina from UTS, is it worth doing a joint submission to these ministers from all the groups attending this webinar? So that's one suggestion. We will be emailing you all after, so maybe that's something that could get off the ground. Russell it's a good example. He asked a similar question, but I just want to give his example. So he said he volunteers with a community group helping asylum seekers and refugees settling into Canberra. We've had to turn our small organisation into a de facto welfare agency to fill the financial gap left by the denial of welfare access for our clients, using donated funds and ACT government emergency funding. We are not well organised for that sort of thing, and there is no way to ensure equitable access. So he asked the same question around funding temporary visa holders beyond, during and beyond the pandemic. A simple question to Monique about the survey that you mentioned. When does it close? I know you mentioned it in the chat, but for others, if you could let everyone know.
Yes, sure. So the survey will close at the end of this week because we're seeking to capture data about clients who are supported in May. But yeah, it would be fantastic if you're happy to complete that survey or to share that survey with your networks as well, because we'd really love as much data as we can collect as possible.
Okay, thank you, Monique. For Carolina, a question for you. How much of Australia's response is ideological, as in fits within the government not wanting asylum seekers entering into Australia?
I think a lot of the response is ideological. As I said before, it's not financial. This is not a financial issue. They are underspent. And politically, we know where the barriers are. Like we know where those it sits in terms of politics and who is stopping this from happening. I think it has to do with the very sadly xenophobic policies that Australia has been showing over the last few years. But actually, you could have argued that the argument of public health in this case was going to be stronger, because it's about, arguing with the government in terms of responses to migrants and asylum seekers has been something that hasn't worked. But arguing in terms of public health, and every single Australian should have been something that should have got some traction. But I think because they see that the cases and the public health issue are coming down, they think this is not needed, but that is that is completely misleading. And again, we go back to the cases of Singapore and the second waves in other countries. This is not going to be dealt with until it's dealt with for every single person in this country. So yes, I do think it's ideological, unfortunately.
Mm. Astrid mentioned that SSI, which I assume she works for, did a pulse survey which 345 asylum seekers responded to within 24 hours. It showed that many go without meals and can't pay the rent. Astrid, if it's possible, if you could share the link in the chat feed, that would be great for everyone to see, I think. If not, you could send it to me and I can send it on to everyone. There's a question here from Nermal, I hope I'm saying that right. Why do we think that the stats on international students keep varying? It keeps shifting between 460,000 to 700,000. Does this say that our system has no clue of what's going on? Does this show that we need to ask the question in the long term, who is responsible for the cash cows who bring onshore, especially now that our government has totally disowned them? At the same time, there is aggressive marketing going on for our quality education in countries like Nepal and India. Carolina, maybe one for you. Oh, she's gone. Monique, do you want to respond?
Look, I don't know exactly why there's such variance in those figures, and you may well be right. But the data that we had was from before, it was taken from late last year, and suggested that there was about 550,000 international students in Australia. It would be good to see more recent figures, because I suspect that some people were able to leave, but that could be why that there's a bit of variance, particularly given the start of 2020 was so affected by the pandemic, especially for international students.
Carolina, you're back.
Sorry, I don't know.
All right. Did you want to respond?
I just wanted to add to this by saying that part of the government's response, and also at the state level, has really been to focus on the economics, and that's why for instance, the crisis response here in New South Wales has been only targeting international students with a way, I mean, it has been this whole of very instrumental narrative about how certain parts of the population are kind of tapped into the economy, and this needs to be done. And it's wonderful this has been done, but again, it's not enough. It's excluding other populations, and it's not enough for those that is targeting specifically.
Thank you. Monique, regarding homeless services, is your organisation seeing increases in women on temp visas, and does that put pressure on them as it's difficult to get an outcome for this group?
Yeah, so it is an issue that was pre-existing prior to the COVID-19 crisis, that for many people on temporary visas, because they aren't able to access an exit pathway because of that lack of access and ineligibility for public housing, many of them do stay in refuges that will kind of support them for 6 to 12 months, sometimes 2 years. In the story that I shared, 3 years. So for services that are already under-resourced and under constant demand, some of them do make a really difficult decision to limit the number of people on temporary visas they will support. So some services will only accept, say, 1 or 2 people out of on temporary visas out of all the clients they support, because of also the costs of supporting people who have no access to any income at all. So essentially services are covering the costs of all the food, costs of the the accommodation of staying at the, staying in the refuge, the cost of any other, needs that the family might have if they have children as well. So definitely is a barrier to people being able to access both crisis accommodation in the form of refuges, because they can't access that longer term housing.
There's a lot of really good comments in the chat feed. So what I'll do is and comments, questions, resources. So I will send this chat feed to everyone tomorrow when I send the survey request, particularly to our panellists. From Han, again, I hope I'm pronouncing that right. Queensland state government is already doing a lot, emergency housing and more packages. The question is, what is happening elsewhere? And if anyone has information about that, it'd be great if you could add it to the chat feed. So I suppose the question is, what is happening around Australia?
I'm happy to jump in. Look, it's really been the state governments that have stepped up for temporary migrants in many respects. Whilst what they've been able to provide won't sustain people over the longer or medium term, they have stepped forward and provided one-off cash payments to temporary migrants and international students in particular. They have assisted with housing. So they have moved to try to at least partially plug the gap left by the federal government. I mean, this really shows why the federal government is so important in these kinds of situations, because people need ongoing support and the one-off measures just aren't sufficient. But it must be said that it has been the state and territory governments that have been leading the way in supporting these groups who are missing out.
Anything to add, Carolina or Monique?
In terms of the state response, as Charmaine says, the only thing we have seen, I mean, the other thing to add is that the state response has been different depending on the states. So some states have covered everyone, like for instance, Victoria, whereas some have focused on specific populations. And that's what I was referring to, that is really not enough. I mean, it's good, and it's certainly better than the federal response, but it needs to be a more encompassed response. And New South Wales was the state that took longer to act, but it's good that they announced this kind of emergency package accommodation for students, crisis accommodation. But yeah, something more needs to be done, but they are certainly being more active than what we have seen at the federal counterpart.
I did want to add quickly that the New South Wales government did actually announce last week that there would be $21 million going towards supporting people experiencing domestic and family violence, but unfortunately, which is really great, and it's really good news. But in terms of people on temporary visas, as yet we haven't heard that there will be any specific funding to ensure that people on temporary visas experiencing sexual, domestic and family violence are able to access supports as well.
Thank you so much. I think we'll wrap it up there. We're just a little bit over at 11 a.m. I just want to thank our panellists, Monique, Charmaine and Carolina, and also thank Chris, who moderated the panel. We really appreciate your time and expertise and your willingness to share. I will follow up with everyone via email, but I appreciate everyone coming and for attending any Impact 2020 webinars. As I said at the beginning, we have a few more left, very different topics this week, but the last one is on Friday, this Friday, the 5th of June. So you can go to impact2020.online to check those out. So thanks again to everyone, and yes, hope you have a good day. Thank you. Bye-bye.
Bye.
Bye.